Vascular disease is caused by several things. The number one cause is aging, and diabetes tends to, or poorly controlled diabetes, tends to cause aging at a more rapid rate. One of the truisms, if you will, in aging a person with diabetes is you say how many years do they have they had uncontrolled diabetes, and add that to their chronologic age. That would then determine their physiologic age. And so diabetes is the number two, let's say, cause of peripheral vascular disease. There's a bunch of others. The good, bad news is being male tends to cause vascular disease at an earlier age. Your diet, as far as cholesterol and that sort of thing, will also cause vascular disease. Uncontrolled hypertension and kidney disease are also part of a group of processes that help cause peripheral vascular disease at younger ages. With diabetes, you want to try and prevent the complication to begin with. And so the key is to help the patient understand that they may have neuropathy and what they need to make up for that, such as inspection, use of skin creams, emollients, special shoes, special socks. Material in socks do different things. As a rule, acrylics or man-made fibers other than Orlon tend to trap moisture against the skin, which allows for bacteria and molds and yeast and fungus that are on our skin to grow, which can cause risk of infection. Thread types like wool or cotton or Orlon tend to wick the moisture off and will help maintain the normal balance of those organisms on the skin. The other thing that Orlon has an advantage over cotton is cotton, when it gets moistened, collapses, so it doesn't pad or protect, whereas Orlon maintains its thread thickness and allows for protection of the skin, so it decreases or spreads pressure over larger areas of the skin. Orlon is a very, very good product. In fact, if you were to go to most any running shoe store or athletic store, you'd find that most of the socks have some form of Orlon blend in them to help wick away that moisture and for that same padding. In fact, there's even a brand, a major brand of hosiery or stockings that make sport-specific socks that have the Orlon thread that they embed some rubber into it to absorb shock to help decrease pressure for various sports. For people with diabetes and people in general, it's a very good idea to maintain at least 10 minutes of aerobic exercise on a regular basis. Aerobic exercise helps increase the heart rate, also the strength of the contraction of the heart, which helps the blood flow, which sends blood to the vessels, which helps the body recognize if there is a disease process or narrowing, which then the body can use its own tools, if you will, to help repair that or to improve that. So one big part of maintaining your vascularity is aerobic exercise. Another component that we recommend for people with diabetes and people in general is that they do some form of stretching. Simplistically, all the exercises that we do as humans, walking, running, treadmill, elliptical, bicycling, shorten the posterior group of the muscles in the leg, which then cause contracture of those, which causes the foot to plantar flex more, which then puts more pressure on the front part of the foot and can lead to problems such as Achilles tendon problems, plantar pressure sores, forefoot neuromas, hammer toes, and then in patients with diabetes, ulcers and other complications. And so we often recommend stretching, and one of the big things that people need to remember about stretching is for muscles. It's not for tendons, it's not for ligaments. You need to make sure that you understand that, because when you do a stretch, you want to feel it in the muscle, not in the ligament or the tendon. There are no specific exercises truly for the top of the foot, because there's only really one major muscle on the top of the foot. But grasping exercises will help the muscles of the plantar or the bottom of the foot, such as putting a towel on the ground and with a bare foot, dropping your foot on the towel, grabbing with your toes, picking up and dropping it. There's also exercise where you can stand on an edge, let's say holding onto the rail of a stair edge and having the ball of your foot on the edge, and my left hand representing the step, and the ball of the foot is the right hand, and dropping down below and rising up on the ball of your foot. And that will help strengthen some of the muscles in the foot. Using a massage tool or a vibrating massage plate will help stimulate those muscles and help maintain some of the muscle tone as well. As we mentioned in the beginning of the interview, that type 2 diabetes or adult onset diabetes tends to hit people in middle age, and it is kind of a silent disease where initially the symptoms aren't particularly overt, or they don't basically hit you upside the head. They just kind of slowly and indolently occur. And what you want to try and remember is if you have a strong family history of diabetes, particularly type 2, you want to make sure that you get a physical more frequently than, let's say, someone your same age that does not have that history. Because if you can get ahead of the disease, you can prevent most of the complications and live a full, successful life without the risk of amputation and other complications.